at the Allambi Building. It's in Launceston, and it's going to become an important part of our palliative care services as the home of the new Allambi Community Hospice. Over the next 2 days, we're going to spend some time with members of the palliative care community, Specialist Palliative Care Services team here in Launceston, also the Hospice Volunteers Association and our friends at Calvary St Luke's, where the Melwood and Finlay wards provide a heart for palliative care across Northern Tasmania. But first, let's go and have a bit of a look at the palliative care that's offered through the Allambi Building.
Hi Heather, welcome to Allambi.
Thanks so much, Odette. It's really great to be here at last.
Yeah, great to welcome you here.
Thank you.
Typical Launceston day.
But I feel the welcome is warm and I'm so excited to see inside.
Okay, come on in.
Thank you.
All right. So this is the Allambi reception area.
It's light-filled and spacious.
It's great for patients to wait here.
So how old is the building?
It's over 100 years old, actually.
Wow.
It started as a hospital, I think an infectious disease hospital.
Right.
So that's why we have all the beautiful spaces.
Configuration, but the garden as well.
And the big balconies on the side as well. So you can see some of the history of the building. It opened in 1921 and we celebrated 100 years a few years ago. And Allambi means
a quiet place of rest. That is just perfect.
It is.
What an interesting history over all of that time.
Yeah.
Yeah. And you can feel that it's a solid, beautiful building.
Exactly. Yeah, exactly.
Really important part of our community.
Yep, that's right. And the proximity to the hospital. So it's still part of the complex of the hospital and healthcare, but it's its own space, which I think will be marvellous when we turn it back into a clinical space, a hospice.
Or if I think of the vision that was shown by having garden areas, the balconies, clearly there was some pretty clever architects back then.
Exactly.
And I understand that there has been a lot of focus more recently on listening to the community, listening to clinicians.
Yeah,
in terms
exactly. And drawing on so many ideas from hospices overseas, hospices interstate. And trying to really create a space that's both beautiful, functional, and something our community can be really proud of.
Yeah, and engage deeply in over the next generations.
Exactly, yeah.
So Odette, when did you begin working with Specialist Palliative Care Services in the North?
In the North, I started here as a locum in 2021, and then more permanent position as Medical Director, Staff Specialist in 2022. Right. So getting on for 3.5 years.
So have you always worked in this space in relation to palliative care?
That's right. So Allambi is the office space for our whole team, bar the Calvary Hospital team. So we have our community, the nurses who work predominantly in community, our consult team of doctors and nurses who work at LGH. Our social workers and other allied health, OT and volunteer coordinators are based here, and of course our wonderful admin staff. So we have that base, and then the other team that we work closely with are the nurses at Calvary Hospitals.
The importance of palliative care. What drew you to palliative care?
Yeah, it's a good question. I did my medical training in New Zealand and my specialty in physician training there. Well, what we call the Part 1 and some additional work in New Zealand, and then I went travelling and ended up in the UK, and actually that's when I first heard about palliative care. It wasn't a specialty in New Zealand at that time, so I often think if I hadn't discovered palliative care in the UK, I don't know quite where I would have found myself working in medicine, because this really was a very good fit for me.
Felt that personal value connection.
Exactly. I was working in an oncology unit in Charing Cross and had the opportunity to go to a palliative medicine conference in Southampton for the Association of Palliative Medicine in the UK, and it was really a bit of a light bulb moment, or if you like. It really felt like it was heartfelt medicine.
This is a beautiful environment to be.
It is. And these lovely spaces in the middle of the Allambi Building, these quadrants, will be part of obviously kept as part of the new hospice environment as well. So we're You know, you can really envisage it as a great breakout space for families and staff, actually, to kind of,
Absolutely.
just to get that, take a breath
Mm.
and enjoy being in contact with beauty and nature. Yeah.
Should we go out there?
Let's go.
Thank you.
All right.
So Odette, clearly palliative care is really important to both yourself and I, but it's often a misunderstood area in the community. How would you describe what's palliative care?
It's such a good question, Heather, because you're right, it's often misunderstood. I think there's still a very strong misunderstanding that it's really just about the last days of life, or sometimes even in the last hours of life, if we get referrals at that very late stage at the hospital. So we do see it as much more around the relief of suffering related to health, serious health-related suffering. And it has a different flavour in different countries and different locations according to need and other services that are available. And we know globally there's a huge unmet need for palliative care. In Australia, because we are so privileged, we have so many other services and a great healthcare system overall. You know, we try to identify, in terms of specialist palliative care, we really try to meet the needs of patients who have more complex needs, whether they be difficult pain control, and sometimes that can be from diagnosis if it's a cancer that presents with significant pain. But we know that pain gets more of a problem as cancers progress, so more generally that means we see patients a little bit later in their condition. The bottom line tends to be also that most patients that come to see us in palliative care, there's a recognition that they have a life-threatening illness. But because we find it so hard to be accurate in prognostication, that if we see palliative care as that sort of care that you get when you're approaching death, then so many people then miss out on good care that they could receive. So also, in addition to the clinical, the medical side, the symptom control, in particular, palliative care is person-centered and family-centered care. Very important. So we see the patient within their community, their family, their caregivers, their wider community, and we're very mindful of supporting the person and all that personhood, their role, their how their hopes, their fears, etc. So all of that comes into it, and that's why we usually have a multidisciplinary team that works closely together to support patients and families in all these dimensions of their care needs. So I could go on forever.
I guess what you're explaining, though, some people might think of palliative care the very end of life and potentially hospital focused. But you're describing a very community model as well.
Exactly. And I think one of the things I love about palliative care is we really try to create a model of care that is truly patient-centered, and we know patients exist out of hospitals. So we're trying to provide care for wherever they are, be it in their home, in an aged care facility, in hospital, and for some patients who really need more intensive palliative care, if you like, in the inpatient hospice. And that need could also be because people don't have the caregivers that available anymore. You know, the caregiver may be frail and elderly themselves. There may not be immediate family around to support them. So, you know, while most of us say we would like to die at home if possible, there's also a lot of limitations to that, and it's not everybody's choice. So we really try and understand fairly early on in our meeting with the patient what they and their family members sort of are thinking around, well, when things get worse, what do I want?
So it
where would
really
I
is-
feel safest? Where would I feel best cared for?
Yeah, very individualised, not
Very
just from a clinical
individualised.
perspective, but whole
Exactly.
of person.
Yeah.
And recognising that changes.
Exactly. And we sometimes support people. We're very strong at not abandoning people. And so we sometimes support people who we think may not be making the best decisions about their preferred place of care, but respect that is their choice, and try and do what we can to make it the best possible outcome for them, because it's not just about, obviously not just about symptom control.
No.
It's about what's meaningful, what is for that person the right thing.
The most important.
Yeah.
Well, the right thing. Yeah. Odette, you've described an origin in New Zealand, a work history in the UK, and then in mainland Australia. How would you describe palliative care services in Tasmania? And, what's your vision for the future here?
Oh gosh, thank you. I think Tasmania provides very good palliative care on the whole, and I'm delighted that now we do have a full consultant medical team, and we do have registrars positions so people can train here in palliative medicine. So that's been enormously an enormous step
helps
forward.
to build retention.
Yes,
That's right.
and we're very proud of that, because we're seeing young doctors that we particularly engage with at LGH who are really starting to be quite interested and want to come and work with us. But in terms of Tasmania palliative care, I think we have a clinical network, which is an important state Department of Health supported initiative. And I think building those connections across the state, the peak body palliative care TAS has an important role there, of course. But those connections across the state are really important, because I think if we strengthen the whole the whole thing.
System.
We
all the boats
strengthen
come up
all.
with the
And
tide here in Launceston at Allambi. And your role does take in the entire northern region.
Yeah.
What would be the experience of Martha and St Mary's when it comes to palliative care?
Yeah. We have our community nurses, specialist nurses, working in different zones. So we do have an East Zone team, and they go across to the East once a week.
Yeah.
And but of course, Mary and Martha and St Mary's, is that right?
Yep.
You're making me think biblically here. She might need care and
More regularly.
much more regularly. But at least through that, we do have ability to connect to the community service providers in the East, because those relationships between service providers are so important.
Network, absolutely.
We've tried to develop an ECHO program specifically to engage with GPs and medical and district hospital staff.
This is the federally driven program?
No, it's not actually. The state of Tasmania actually took out a contract with, has a contract with the ECHO people in New Mexico. Yeah. And under that auspice, we have set up our own Northern Tasmanian Palliative Care ECHO program. And once a month we hold an education, really aim to get GPs from the district hospital, well, the more rurally based areas of the north engaged. The two areas that are really engaged with this program, however, are Flinders Island and Deloraine. Occasionally staff from Scottsdale Hospital, Georgetown Hospital, St Mary's Hospital will participate. So it's that ECHO model of a short didactic and a presentation by the local service provider. Yeah. The aim of it really was to build regional capacity and relationships, and facilitate the referrals from GPs to our service. So there was less of that specialist generalist.
We're very wet, Dawn.
Yeah, we're getting quite wet. It's making me laugh.
Every now and again, there's a really big drop that falls from the leaves. It's
sort of it makes it a little bit amusing, actually. So we need an umbrella.
Oh, we do.
Daniel,
make yourself useful.
The tree's doing its best.
So Odette, mid-May, from the 10th of May, right across Australia, we recognise National Palliative Care Week for you and I, that's really significant. What would you say to the community? What's the importance of National Palliative Care Week?
Oh, it's a very important week for raising awareness. I know just friends commenting on, I think everybody's business when that was happening, that particular theme, and seeing it on buses and some of the TV advertising, I think that showed that palliative care can be involved,
It is everybody's business.
Everybody's business, and also involved earlier in the patient's illness. It's not just about that end of life. I think palliative care needs to be recognised as the way, a very well-established, holistic system of care that's available in Australia to help people who are approaching the end of life and actually dying to die well. I think some of that dying well.
So, Odette, hearing from you about National Palliative Care Week and the phone calls that your service receives, what I'm hearing is that the theme for this year across the nation, getting to the heart of it, big questions, real answers, is really germane. You're keen to see greater conversations about palliative care?
I am. I think we've talked so much over the years about trying to break down some of the barriers that exist in the community, but also within healthcare provider sort of thinking around palliative care. And it's still, but I'm afraid the misconceptions are still present and maybe perpetuated partly by other healthcare providers. And, it's such a complex issue because it's still, palliative care does care for people approaching the end of life. So it has that undeniable link with death and dying. And, no matter what, even if people die well, dying in itself is still an enormous, challenging, momentous area. And so we'll always, I think, have some concern, but I think around raising the conversations. But I think if we just focus not so much on palliative care as because you're dying, but more palliative care, we work together with, I'm thinking about the health providers, we work with those palliative care teams to ensure that you're getting good care when you're out of hospital, that your family is supported, that you're able to be reviewed regularly without having to come into outpatient clinics, that we're not abandoning you by referring you to palliative care. We will continue to do what we can to provide the best health care in other areas as well, but we don't want you to miss out on that dimension of healthcare. I think that would help rather than, this.
As you were describing that, it's the word dimension. There are so many dimensions to palliative care, so increasing the conversation about those.
And raising an understanding of what it can mean. And I mean, sometimes we find people have an unrealistic expectation of palliative care, but that's okay. We can
work together
conversation.
That's right.
We can try and work that out.
Well, I really appreciate the opportunity to catch up today. We've covered a lot of ground, and I'm looking forward to working with you not only during National Palliative Care Week, but of course, I'm really focused on ensuring Palliative Care Tasmania does represent all of Tasmania and the importance of not only our urban centres, but our regional and rural areas as well. It's been great to get to know you. Thank you.
You too, Heather. Thank you so much for making the trip to the far north.
I love it. Thank you. So, Annette, it's lovely to join you in Launceston here today. We're in one of the central courtyards at a building that is known as Allambi. And I'm really keen to ask you today a little bit more about your role and the future of Allambi. Should we take a seat?
Absolutely. Thank you for the invitation to join you.
Lovely. Thank you. So, Annette, I've only come to know you quite recently. I'd love to hear a little bit more about what you do. What's your title and what does that do?
So I am the Assistant Director of Nursing for Primary Health North. So I'm responsible for having managerial oversight of a lot of the community services in the north of the state. So services like the Community Rapid Response Service, the Hospital in Home Service, Community Nursing Service, Wound Care Service, Continence Service,
Oh, wow.
Community Dementia, and the Specialist Palliative Care Service.
And I could see that there would indeed be connection between some of those. Where we're sitting right now, it's a hub of activity, and I can see a presence of many of those services that you've just described. I understand that there's a vision for the future of this building, this site. Can you tell me a little bit more about what that is, how it came about, and how's it going?
Absolutely. This is going to become the new Northern Hospice, which we are extremely excited about. We have previously contracted beds from Calvary Healthcare for the provision of inpatient palliative care, but it's long been a dream to have a designated specialised inpatient palliative care facility, and that has now come to fruition, which we're delighted about. So yes, it will be based here. It'll be a 12-bed facility, and we know that in Tasmania, there has been in the past, particularly in Northern Tasmania, there has been very limited access to inpatient palliative care. About 75% of patients who are at end of life actually receive their care in inpatient settings, not in designated palliative care facilities. So the new hospice is going to allow us to provide, high quality, specialised care that's going to focus on, that holistic approach, that dignity, quality of care, comfort and support, by qualified, trained, experienced staff in a setting specifically designed for that. And we've got a wonderful team of architects in Jaws Architects who have really listened to the group involved in the development of the hospice. And, I think it's got some beautiful features. And I think it's going to be an absolutely wonderful facility.
I'm really excited about it. I know that it's been 2 decades since there's been a dedicated hospice available of this nature in Launceston. And of course, the designs that the architects have been developing through consultation are intended to be very future focused. Can you tell me a little bit about what we will be sitting here experiencing when completion ends?
So as I said, there'll be 12 rooms. They will all have external access, so their own private verandas and access to external spaces. We'll have beautiful garden areas developed here. We're going to retain our beautiful trees in this space. So families will be able to come and go. It'll be a very pet-friendly facility as well. We're going to be trying to promote, birds and whatever wildlife is around to visit the facility and have patients be able to see that. We've got areas dedicated to family spaces where families can enjoy a celebration, or their relatives or friends can cook a special meal for them. We're just in the first stages of considering the type of artwork, but the preliminary designs for that, really quite special. It's just wonderful to be able to design a facility from scratch with every detail focused on, patient needs and, good quality palliative care. And I think that is going to make a huge difference. Although the facility is existing and we've got a few constraints because it is a heritage building, we've still, I think, been able to really optimise the use of that space and create some beautiful environments.
I have to say I've seen some of the designs and we'll be sharing them with our audience as part of this series of conversations as well, and I'm really excited about it. It's very, very person-centred, whole of person-centred. It's not clinical, despite the fact that there is a clinical dimension that will be part of that support as well. So it's quite unique, something very, very special. I'm excited about seeing it come to fruition, but I know these things take time. Is there an expected completion date at this stage?
Once we start construction, I believe the timeframes were around 18 months.
Okay.
So we haven't got a definitive start date yet, but I think we're hoping it will be, as soon as possible. But yes, because we're very excited too. I love the starry sky in the rooms, particularly. I think they are just gorgeous. And I mean, you quite right in that it doesn't. It's nice that you say it hasn't got a clinical feel, because we didn't want it to have a clinical feel. We wanted it to feel comfortable and calm and home-like and really promote a relaxed environment. So there's a lot of attention to detail on things like noise suppression, light suppression, having maximum darkness in rooms, not flashing lights, noises, alarms, those sorts of things. So yes, I think that the challenge now is to make sure that we build it exactly as planned.
Of course.
So it's as beautiful in reality as it is looking in paper.
I'm only new to Palliative Care Tasmania, but this was one of the really exciting projects that I became aware of in my really early days of looking more deeply into the big things that are happening in Tasmania. I'm genuinely excited. I know that so many across the northern half of Tasmania feel the same. So, Annette, we're moving into National Palliative Care Week. It starts across the country, of course, on the 10th of May. And the theme this year is getting to the heart of it, big questions and real answers. If I consider what you've been working towards with the vision for Allambi, how would you describe getting to the heart of it, what it means to our community?
I think that it means that all our community members in the north will have access to quality end-of-life care in a purpose-built facility, which is really important because they haven't had that up to now. I think the fact that the building's part of the LGH precinct will also mean that, if they need additional resources and support that are provided by the LGH, they'll also be able to easily access those. But I just think it will, for anyone who's caring for someone at home who's dying, I think for them to be able to know that there is a specialised facility that they'll be able to have access to support their loved ones at end of life and optimise the quality of care, I think is going to be just fantastic. Palliative care is very different to hospital care and routine clinical care. And so that will be very, very important. I think too it'll help relieve bed block at the LGH to some extent as well, because it'll mean that dying patients aren't cared for in inappropriate settings. They can come to the hospice and be supported here, which I think will be really lovely.
It's a benefit in both contexts.
Absolutely. And patients will also be able to come. Not everyone will necessarily die at the hospice. We may have patients who just need some symptom control or a bit of care and support or need to help in managing their death at home, and that it'll be great as a resource to help support that as well. Absolutely.
Annette, I can't help but think our theme this year, you've been living this, you've been getting to the heart of it, you've been asking the big questions, and you're about to continue to move ahead with some real answers. So congratulations on everything that you've achieved so far.
Thank you so much, Heather.
Been a pleasure to catch up. Thank you.